My name is Elizabeth Schachman. I am a producer and the new education reporter at Minnesota Public Radio. With me today is Art Rolnick. He's a senior fellow at the Humphrey School of Public Affairs at the University of Minnesota, where he is an expert on the economics of early childhood. Advocate. Mary Brainerd is former president and CEO for Minnesota-based Health Partners. Mary's also on the board for many organizations, including the Center for Economic Inclusion, the Bush Foundation, Syker Incorporated, Brainerd Financial Corporation, and Minnesota Public Radio. And Nguyen is assistant commissioner at the Minnesota Department of Education, where she oversees the divisions of state and federal government relations and early learning. So we're going to talk for about 45 minutes, and then we will have time at the end for questions, so I hope that you will have many of them. And we just appreciate you being here and giving us the time to talk. So I wanted to start sort of where we left off with the last panel, which is with Art. Jumped in and said something about marketing and economics. And I think that a lot of Americans, you see this in the news, you see this in movies, in the way, even I had a conversation with my neighbor yesterday who serves, she works as an economist in city planning for Shoreview, and how we think about economics. I think we like to think about our economy and our successful leaders in terms of this sort of mythical Steve Jobs hero mentality that somebody starts in their garage and comes up with this great idea on their own that changes, revolutionizes communication and technology, or we have some politician come out and rope by their kind of heroic leadership, they rope a company in to revitalize the economy in a certain area. And I would like to ask Art why that might be wrong and how we should really think about economic development.
I'm not sure that's wrong, but I do want, and I said it earlier, I wanted the business community in particular, but generally the public to think about early childhood development as economic development. When Rob and I first started looking at the longitudinal studies, we were asked by former governor of the state, Al Quie, and a former mayor of Minneapolis, Don Fraser, to take an economic analysis. And I was a little skeptical, thinking, I don't know if we could really make the case. But when we compared the kids who were in high-quality programs to the kids who weren't, and look at outcomes long term, the evidence was kind of overwhelming that we can get this high return on investment. So, I had railed against for many years public funding of private companies. You don't want to get me started on stadiums, but for the last 10 plus years, the state has spent $1 billion on building sports stadiums and arenas. These are private companies. They would have done this anyway in some form or another. And probably what's well known now to all of you is Amazon headquarters. They're going around, I think they got 20 communities bidding on that headquarters. I think New Jersey's up to $7 billion, okay? They're gonna locate somewhere in the US. That's no new jobs. It's a question of moving them around. Where are they gonna locate? So Rob and I were claiming we got a much better investment than that. We claimed, in fact, an 18% inflation-adjusted return based on the Perry Preschool study. Heckman had a 13% return, but we have double-digit returns from these studies, and we're just making a very simple economic argument. We got a much better public investment because most of the return on investing in our most at-risk kids, the public benefits. So the economic argument we thought was pretty straightforward. Let's look at the best way to invest money. This is your current workforce, because as you build more early ed programs, you're going to be hiring more teachers, et cetera. And it's your future workforce. So it's real economic development, and it's an economic development that we argued, and no one's disagreed with this. This is 15 years later, the best public investment we can make. And one final point, this sounds like a lot of economic theory, but we've been very successful in actually funding what we call the Minnesota model for early learning, which is mentors with our parents starting as early as prenatal with an early learning scholarship, and it's driving the market. So if you go to the north side, where the North Side Achievement Zone is very active, About a year ago, New Horizon, a for-profit, opened up a brand new early childhood 4-star rated program in that community. And I argue it'll create more jobs now and in the future than that Viking stadium over there. So you want real economic development, you want it in the places that need it the most, you want to deal with equity issues, you can't do better than this as an economic investment.
And for Mary, I'm really curious. So, we've spent the morning talking about early education, early childhood education, investment there, the importance of that. And I hear a lot of people in the room, nodding, agreeing with that. And there's a lot of questions. How do we scale this? How do you implement this? And I'm curious, with your experience at Health Partners and running a big company, how you think and what you've learned about infusing people in your company with values like this. What does that look like from a leader to kind of infusing people in the company with, these sorts of priorities as they go about their jobs?
Well, actually, I think the values that would cause you to invest in little ones and families are, for the most part, why people wanted to go into healthcare in the first place. So that's kind of an easy sale, and the alignment there is so strong. What has been a pleasure in trying to do that work is just being able to open the door to a conversation about what you can do differently. And so, I'm a big believer in, 8 times 8 ways. You need messages, 8 different places. You need the messages when they're relevant to you. You need them in ways that you can understand. You need them in ways that engage you. And clearly, when it comes to early childhood, healthcare is one of those places where it might be just in time. It might be the message you need to hear, and it's often a trusted source of messages. And I think that's not lost on the people who work in healthcare. So it really has been a great opportunity to be able to think about what would you do differently to redesign healthcare to support information that parents need and families need, to change the way healthcare itself is delivered, to stop focusing on sickness care or only medical views of children when they come into the healthcare system, and instead start to invest in behavioral screening earlier, adding services at prenatal times, connecting with Reach Out and Read, so even simple things like giving a book at a well child visit can be accompanied by a message about the importance of early brain development. And then what you learn is once you start changing things, people need other new connections. So they see so clearly a need for more connections to really good childcare, and they see more need to connect to people who can provide services for kids who have been through developmental screening but need support in the community. And then you start to see, oh my gosh, part of the challenge here is 40% of kids in our region are born into poverty, and that's the biggest challenge of all. And then if you're somebody like me, you start wanting to take a much bigger view, which says, how can we change the environment we live in? What might our policy agenda start to look like? How can we work together more effectively? And how can we amplify the challenges that we face so that more people start making this a priority when they vote, when they meet with their neighbors, when they advocate in the many ways that we all know we can. So for me, it's why a connection with an NPR is a really important part of continuing this work personally. And a lot of good things are happening in healthcare, so that's one dimension to it, and there are many others that people in this room already know and represent. So I think social change is what's needed. This is a social movement for children that I think we need to create.
I hear you saying every little bit counts.
Absolutely.
Yeah. So I want to go back to the well child visit that you just talked about. So I have a baby who just turned 1 this weekend, and it's about time for his 1-year-old well child visit. When we think about all the different ways to connect with parents, what I hear from a lot of the people today is that early childhood is a way when you focus on early childhood development, you focus on the whole family. You're reaching more than just that one child. That investment is going to go really far. And so, talking about scaling, in this well child visit, what should be happening? What are the opportunities there? What are ways to innovate in a setting like that?
Well, so some of it is, what do you talk to mom about? And I still remember one of my early, spend a half a day with a pediatrician, and I asked her, what do you spend your time on? She said 3/4 of it is coaching and teaching parents. And so part of it is helping parents take control of that opportunity to talk about what's important, what's happening with their child. Not only talk about immunizations, which are extremely important, but sort of moving beyond that and height and weight to a chance to observe a child in a setting to see, how are they connected with mom or dad or the caregiver they're with, and is holding going on, is smiling going on, are there some words starting to come? It's really opening up the relationship to be a much broader one than just the physical screening that my kids went through.
Absolutely. Wei, working in the Department of Education, I sort of imagine a lot of policy administration, a lot of bureaucracy. It was hard for me to get a handle on what exactly you spend your time doing. But in talking to you, it was really interesting hearing how you think about your job, how a lot of your work is inspired by personal experience and informed by interactions with people you meet in the community, real people, as we in the media and sometimes in other spheres talk about that. What are you learning there? Tell us a little bit about what you're doing and what you're learning on the job about early childhood, and as we've been talking, how to wrap around the whole family.
So, thank you for that. I do think that a lot of my work has just come from personal experiences, from my own personal experience growing up, from talking to community members, from talking to individuals and service providers that work with community members. I came into working for state government and public policy because I really do think that just state government, local government is there to make a change. We are there to see what the needs of the community members are and address those needs and see how we can positively impact people. I think, unfortunately, for a long time, state agencies maybe got away from that and didn't really take the time to listen to the communities that we are serving and really understanding what they need and how we can best help support them. And so over the last few years since I've been at the Department of Education, in collaboration and partnership with our partners at Department of Human Services, the Department of Health, and all of our great partners out in the field, we've really just spent time going out to communities, to where they are, and listening to them and partnering with them. I think there was, for a long time, we listened to the experts. We listened to people who worked with the people rather than really listening to the people who are getting the services themselves. And oftentimes what we were actually hearing learning was that we were getting conflicting messages. And so I think, again, focusing on those individuals that are benefiting from our services and understanding why they're not. We have a lot of different programs and services out there, and they're being underutilized right now. And so why are they being underutilized? What have we done in the past that has created barriers for people, that have made us unwelcoming to those very populations that we are trying to serve? So that is something that I feel that I am very passionate about and that I can bring to the Department of Education, and I know all my colleagues around the room too who work at the other agencies, they're bringing that to their work in their agencies.
Why are they being underutilized? What have you learned?
I think they're being underutilized because of misconceptions about what the programs are. How do you qualify for the programs? I think we were just actually having this conversation. There's a fear about accessing public programs right now in this climate. We have learned from our food and nutrition division that we're seeing a decline in families applying for free and reduced lunch because there's this perception that if they apply for the program, they are not going to be put on some type of government list, that they are going to be targeted for something. So the big mechanism that we have to identify those neediest children, people are not using because of fear of something else happening to them.
I think as we're learning more about this, and from so much of what we heard this morning, Art, is that what happens in early childhood development is it's not the classroom. It's connected to so many different things. It's connected to family. It's connected to transportation. It's connected to geography. It's connected to background of parents and caregivers. When you think about early childhood education, what are some of you published this paper looking at the economic benefits of investing in early childhood development 15 years ago, and what have you been learning since then about what's important to sort of all the different areas that we need to look at, the connections that we need to make to make this actually happen?
So I've learned a lot in 15 years. I'm on a learning curve, guys, and this is why I love holding conferences like this and being at conferences like this. So what I think, first of all, the evidence is overwhelming that we're way under investing in our at-risk kids and their families. And that's the 18%, for example, return makes that case. But the thing I learned the most is this isn't about empowering programs. This is about empowering parents. And if you think about the Minnesota model of early childhood education that we've implemented here, it starts with the parents when we can, prenatal, with a home visiting nurse, maybe triage to another type of parent mentor, but it's very much the Northside Achievement Zone, the NAS model, and the Way to Grow model. And this isn't just theory anymore. Fortunately, we had the business community kind of read our stuff. Warren Staley, Rob Johnson here from Cargill, Best Buy, Ecolab, General Mills, they bought into this and they said, okay, Rolnick, let's get you out of the ivory tower at the Federal Reserve and let's see if it'll work in the real world. And they raised $20 million privately to test this out. So we knew there were all kinds of problems. People came with all kinds of issues about, oh, you got to get these organizations coordinated, you got to get everybody on the same page, you don't have enough facilities. I couldn't tell you all the critics that were out there. And I said, no, all I need is an empowered and engaged parent, and watch out. And so what we did, we created a rating system. It's called Parent Aware. And then we provided these parents with scholarships and mentors, all voluntary, by the way. Critics said, oh, the parents won't even use the scholarships. Every one of our 650, virtually everyone used the scholarships. Okay. We tested our kids out. They were doing close to national norms. They were starting school ready. I should point out that roughly 70% of the kids in Minnesota start school ready. Poverty kids, it's 30%. Historically, in the Northside Achievement Zone, it was 18%. Well, the Northside Achievement Zone, we're up from 18% to close to 60%. Way to Grow is close to 90%. So we've got results. Okay, so this isn't theory anymore. I know we can get better. If I can get Judy here full time, I know we could be at a quick learn. But I'm going to tell you, even if we're like a startup company, getting you a high return, and the more data we get, the more we learn, we're only going to get better. And my point to the political system is not 5 years from now. We don't need more research. Now is the time to fund this for every child born into poverty, for every child born of an incarcerated parent, for every homeless child. We know it's a huge investment, a huge return on investment for the public. So I just want to make it clear, this is not just theory anymore. This is not just research. We're doing this. We're having this huge success in Minnesota, and I'm glad to say there are a number of communities around the country that are replicating what we're doing here. And so hopefully in 5 to 10 years, we'll start showing that we can not only close the achievement gap, but if we do this right, and health is a big component of this, we can prevent it. And so that's the way, asked about marketing. We market as economic development, and the key, and they got the business people involved, we can show results. So so the critics who say this is theory or there's fade out, sure, there's some fade out. We're still getting you double-digit returns, and we'll only get better. So results are very important. Once you start asking for the kind of funding we're going to need, we're asking for $400 million per year so that every child born into poverty at risk will have this program. So it sounds like a lot of money. Well, this state produces $350 billion a year. We can easily afford this program, but we've got to get the message out, and I think results matter. And so I want to, again, give a big shout out to the Northside Achievement Zone and Way to Grow. That's giving examples of, indeed, it works.
When you mention programs like this that you're seeing come back with real results, what are characteristics that you're seeing of programs that are really doing a good job, that are really coming back with these great results?
Well, Mina is a good example, but you have parents that have been through this program, and we get these testimonies, and they tell their story. And the one story that did me in, we were in Wayzata here, Wayzata Country Club, and they have a interfaith group out there that has raised private money. They got 175 scholarships that go to every year to at-risk parents. And they brought one of these parents to the breakfast, and she had fought in Iraq. And she comes back to this country, and she's very depressed. She has two very young kids who are not doing well. Her minister said, you know, there's this new program here. You should apply for a scholarship. So she does for both kids. She gets them in a New Horizon 4-star rated program in the community. And she brings her kids up on stage, and they're just bright, happy kids. And she is now a full-time job, went back to school, has a full-time job, is engaged. You know, when Rob and I and James Heckman, when we start calculating the rate of return, we were just looking at the kids. But we're affecting the families, and we're starting to get at trying to show the results are not just for the kids and the families. So the programs that work the best, they start with the parents. And earlier the better. You can't start early enough. And so that's the heavy lifting in mind. It's not just simply taking a child and putting him into a pre-K program. This is really about, you want these sustainable results, you get that parent. If you give me an engaged and empowered parent, and we may not get it all right, but we're not going to go too far wrong. You go out where I live, out in Plymouth, Wayzata, a fairly wealthy neighborhood. These kids don't end up in jail. And what do they have out there? Quality programs, but they got engaged parents with a lot of information. And that's exactly what we do. We provide through the mentors, and we connect them with existing resources, which is an issue. And we're having a lot of success connecting them because they've got a mentor working with them. That mentor is there 7 days a week, 24 hours a day. If a car breaks down, if there's a medical emergency, there's somebody they can call. Many of these parents never had anything like that before. So you want to reduce stress? It's huge. So back to the question, the programs that are successful really empower the parent. That's what we need to focus on. Not empowering programs. I mean, programs need resources, but our focus should be on that parent. That's how we know we'll get the sustainable results.
What could you add to that, Mary? What have you learned about kind of coming around empowering parents, investing, as I really like that phrase that Art said, not investing in a program, investing in parents, investing in people?
Yeah, well, first, I completely agree with Art's points, and I think what I would do is add, first of all, preschool is incredibly important, but the time before preschool is incredibly important. And there are knowledge gaps. All the professionals who deal with tiny children don't know the science. Parents don't. The work in California would say that's a big gap, is young moms just don't know how critical those first 3 years of life are for brain development. And so if we wait till age 3, we're actually waiting too long, which is why this earlier part of the program that Art's talking about is so important. And that can be delivered a lot of different ways. But we know that when families have a new baby, they want that baby to do well. They want good things for their child. And sometimes just don't know that the experiences that a child has in the first year of life really set the course for their future life success. And I think understanding the critical nature of that time, and that we're talking about not rocket science kinds of interventions, we're talking about snuggling and cuddling and holding and singing and reading, but I have a 2-year-old granddaughter, and if you tried to read to her for a half an hour, it would be an exercise in futility for everybody. But sing a song, do the dishes together. Those are all things that make a huge difference to a child's future. And we just haven't helped parents see that all the time. So I think that's a thing I would emphasize. It's where healthcare can make some difference, because we see lots of families, lots of times during a pregnancy and the early months after a child is born. But churches do too. And other child care organizations do too. And schools do too. And community organizations do too. And I sometimes think one of the things that's currently standing in the way is there's a lot of fragmentation. So approaches that help parents make decisions and get connected, really important. That's one of the strengths of NAS, is making those connections. It's where you'd like to see huge scale implementation of things that we know can help. I look at Barb and think, what if Think Small was 10 times the size it is now? And how could we make that happen? I mean, it's that kind of taking to scale that I think makes a difference. And so kind of before, ending remarks on this topic, I just say there are 4 things that UNICEF calls out worldwide as indicative of a country that's committed to kids. And so if I can keep it together to remember all 4. One is support for breastfeeding. And we're doing better on that, but we're not doing nearly as good a job as we could in supporting breastfeeding for moms. The second is making sure that families have 6-month parental leave. That's happening lots of places, not happening here. The third one is making sure that all kids, data is used to identify kids at high risk, and making sure that there's an intervention to support those kids. That's Art's point. And we're not really doing that very reliably either. And then the fourth point is making sure that kids have universal access to 2 years of pre-K education. So are very many countries doing that? No. But are some countries doing parts of that? Yes. The U.S., 0. 0 of 4. I think that's something we need to change for our future, and it's why, for me, it's got to be knowledge, awareness, social change, and action. And as far as I'm concerned, if we could get to action at scale for those 4 key points, that would be the best.
I just want to jump in with a comment on scalability. Many of you may know of Jeffrey Canada from the Harlem Children's Zone, and the work he's done is amazing there. He had me come out and talk to his board of directors because I got a big problem with his program. And you can imagine me going to Harlem and telling them they've got a problem. And I pointed to Jeffrey and I said, here's the problem. I can't clone him. How do you bring Jeffrey Canada to scale? And I said, what I can bring to scale, what we can do to scale here, we can provide every at-risk parent with an at-risk child a mentor and a scholarship. The 4 of us could probably run the agency. Or Barb Yates could do it for sure. It doesn't take a lot of overhead. It is something that's very easy to scale. We could scale it with the funding. We could almost scale it overnight. And so as you start to look at proposals that people make in the early childhood, most of them are proposals starting at the top. We start at the bottom with the parents. We don't start with the programs. It's not clear how you scale those. I know there are some great people out there like Jeffrey Canada. But again, the parents we can empower and we can scale that. And that should be a critical component when you get in the public policy space. Can you scale it? This is scalable. We can do this. We're starting to do it here. And there's other communities. Cincinnati in particular is doing something like this. This is not difficult to scale. Keep that in mind. We won't go too far wrong if every one of these parents, these poverty parents in this state had this program. Believe me, we would not go wrong in terms of a return on investment.
I want to go back to something Mary said about access to programs, access to resources, and how complex that can sometimes be. The Minnesota Office of the Legislative Auditor recently found that Minnesota's early childhood programs were complex and fragmented. As the child of a preschooler who's tried to figure out what's available out there, I can concur. It can be confusing, even for somebody who lives in the suburbs, who has a college education, who has access to a lot of resources. It's confusing. How are you thinking about this? How are you thinking about communicating with other departments? How are you thinking about communicating with parents?
So I will say ditto. As a mom of 2 young children living in the suburbs as well, it is a maze. So I will say I use the peer-and-aware rating system myself.
There you go.
I also my kids also went to public preschool, so I utilized both systems. So we have been digging into the OLA report, and we are, as the 3 agencies and as the Children's Cabinet, trying to look at all the various different laws. What we found and what the OLA is finding is that there are similar eligibility requirements, but not exactly the same. There are similar program requirements, but not exactly the same. And so really having to kind of do that crosswalk of what should the eligibility requirements be? What are the high quality program requirements? What should those be? Can we agree to those? And then can we then look at all the various different programs and see how can we align all the programs? Right now, we can't do that ourselves. A lot of those requirements are in statute, so we will have to bring those back to the legislature and say, these are what we think the requirements should be. We think these are what the eligibility should be. We think these are the target populations that we should be targeting and making sure that we are providing the services to these families. Another thing I think is, again, marketing and having people understand the various different services and programs that are out there and the reasons why they are there. Home visiting is there for a reason. Home visiting goes right into the homes of families, prenatal birth, and they help the families. They help the families understand what's a safe environment for your child. What should you know to raise healthy children? They help identify problems early on. I think what's key is early intervention too, right? I think scholarships and other preschool and other programs are great and funding models, but I think that what you also really need to do is make sure that the people who are working with the children are able to identify those things so that we can really target and meet the needs of the kids early on, so that we aren't seeing them later in life where it might be more difficult for us to try to address and much more expensive for us to address. My child needed speech therapy. We took him to some singing lessons, right? And it worked. It was great. So again, I think it's just looking through, unfortunately, I think it's been wonderful. I would say over the last 8 years, we have done more in the area of early learning than we had ever done in the state of Minnesota. We now invest over $300 million in early learning at various different levels. We have more programs than we ever did. The thing is, they all sprung up really quickly. And so almost every year, every other year, there was a new program developed. There was a new funding model developed. There was something, and nobody was really taking the time to really assess the entire landscape again and saying, does this make sense? Why did we create this other program that is almost exactly like the other program that we have, except for 1 or 2 different requirements? Why did we do that? And so I think I don't think we should stop by any means. We have great momentum, but we do kind of have to kind of just take a step back a little bit and kind of take a look at the entire landscape as a whole.
And just say something about Parent Aware. So we struggled with Parent Aware in coming up with a rating system. And as you can guess, there's a lot to learn about what is quality in pre-K. We think we're doing okay. We've worked with the university, and if you go online, we give you the assessment. You learn a lot. Ultimately, though, at least with these pre-K programs, we're going to be able to tell you what percentage of the kids in that program start school ready. That's our outcome. And ultimately, if you're going to keep your 4-star rating, we expect a high percentage of your children to be school ready. So fortunately, we'll have outcome. But recognize when it comes to quality in education, come on, we debate K through 3, we debate middle school, we debate colleges. It's not just an issue of what is quality in pre-K, it is quality in education. The only thing I've come away with, the human interaction is critical. And I even argue at higher education it's critical that not one size fits all, and some kids can do better in other arenas. Some prefer large schools, small schools. But I would argue from what we've learned from the neuroscientists that there's something about that human interaction at all levels that really make education work, in particular at the early ages. And so one of the quality parts of that we look at for Parent Aware is the size of the classroom, how much interaction you have with the child and that parent, how much human interaction you have. But again, we're on a learning curve. it shouldn't be a showstopper. I mean, people all say, well, what is quality? And if you get enough of the academics involved, there's a real debate about what quality is. That's fine. Let's continue to debate. But that shouldn't stop us from making that investment.
I just like to add, I think that Ready for K is one really important marker. But there's so much evidence that in those very early months and years of life, you're talking about a child's social and emotional intelligence as well, their ability to connect with people for a lifetime, their ability to have friends and family and meaning in their life in a way that extends beyond academic performance. There's a lot of evidence that resilience and a child's view of the world is formed in those early months when they decide the world is a friendly or a hostile place to be. And so the investment of time and energy in helping parents see that picture, in making it clear that we're not talking about having to teach your child how to count to 25 by age 2, that we really are talking about cuddling and snuggling and singing with a child in a way that gives them the right start in life, is where it all begins. So it's, I think, a both and that social emotional part for me is just as important. What kind of people do we want to have in our community? And I think we want people who are able to make those connections.
So absolutely agree, and you should know Minnesota was way ahead on this. Our school readiness assessment, 32 variables, I think half of them include social and emotional. So when the kindergarten teachers do that assessment, they know what you're saying. It's not just academic. Absolutely, absolutely.
So this is something all morning we've been talking about, and I've heard you, Art, say that a focus on early childhood development is something that people on both sides of the aisle can get behind. But I would say that there's a little, Minnesota is certainly among those having the debate about what that looks like exactly, how to scale that, how exactly to invest money. And there's a debate about, do we provide programs and services at the same level for everyone? Is this a universal application? Or do we target certain communities based on testing, based on other factors? What have you learned? This is a question that all of you might have something of an answer to. What have you learned about what conditions, in which conditions it is helpful to provide this? What are we learning about the application of this, I guess is my question. Universal versus targeted.
Well, I should say I got kind of surprised on this. I thought once we presented this research on at-risk children, it would be a no-brainer, no pun intended there, that we would be investing our limited dollars in our most at-risk kids. All the research says there's a huge return. These are the kids who typically don't, on average, don't finish high school, end up in crime and other problems. This is a huge return to the public. It seemed to me once this research is out there, we're done. And what happened is politically, and I understand this, if this is good for at-risk kids, it sounds like it's good for all kids, and why don't we just do universal? Why don't we do this for everybody? And so I'm well aware that we have in the public space limited dollars. And so the proposal that came out from the teachers union in particular here in Minnesota and other parts of the country is let's do this universal for public school only. Why public school? Because they claim they can do the best job. That was the argument. And so I looked at that and I said, wait a second, we know too much now about brain development. 4 is too late. And I don't understand, given that you have to start early, why would you put all your money into that? And given that to do universal for public school only, you need about twice the amount of money we're talking about just to do it for 4-year-olds, because you're doing it for everybody. And then there was the superintendents of the public schools testified they didn't have the infrastructure, and they need $1 billion or more in infrastructure. So they're going to spend a lot of money on middle class and upper middle class kids, and the public return is virtually zero. There's some private return there, but the public return is virtually zero once you get there. So that didn't make any sense. And then finally, and when I had this debate with some of the supporters of the universal public school only, I asked them, where did you send your child and your grandchild? Oh, they said Montessori. They said language immersion, Joyce Preschool, or one that I love, by the way, is McPhail. McPhail, they sing to the kids all day
Right.
long. I just love that program. But I said, wait a second. If that's okay for you, for middle class, why wouldn't you allow a poverty family to have that same choice? They could choose public. They could choose Head Start, as long as it's 4-star rated. But why wouldn't you give them that choice? And I've yet to get a coherent answer on that. Also, I have yet to get a coherent answer on the public school does a better job. Because I asked for that research. They said there was research. There's no research. It happened when we had this debate. New Mexico was doing a study on public and private programs, and it was a toss-up. They're great public programs, great private programs. We're saying we need all hands on deck. We want parents to have these choices. One size, Scott and I were talking about this, one size doesn't fit all. We know that. We know that from our own kids, one size doesn't fit all. So let these parents figure out with their mentors, working with them, what works for their kid. For some kids, it may be McPhail. It may be singing all day. For some kids, it may be Montessori. It works, actually, Montessori worked great for my granddaughter. It didn't work well in the public schools, but Montessori worked terrific. So let the parents figure this out. Why wouldn't you? Especially, and again, when they send their kids to these private programs, I couldn't figure out. I know politically why. Again, universal sounds great. If you're not in the weeds, the public says, oh, yeah, that's a great thing to do. But if you don't have to get too far in the weeds to realize that'd be a mistake. And my concern, and this is happening in New York City as we're talking, because the mayor, de Blasio, and I'm on his advisory board, they went universal 4. And the evidence that I have so far from their staff is it's mostly turning into a white middle-class program. Because the most at-risk parents aren't taking advantage of it. They don't have the mentors there. Now they're talking about Universal 3. They're spending a lot of money, and my concern is they're not going to close any achievement gap, and they're going to come back to guys like me and Heckman and say, see, it failed. And what they're missing the brain development research. They're missing the importance of engaging the parent. They're missing starting at the beginning. They're missing that this is as much about health as it is about education. Absolutely. And so that's a problem, obviously a political problem, and how do you convince the public and convince. I would say this, our governor, Governor Dayton, was on both sides of the issue. He helped fund scholarships, and he's helped fund some universal programs. But I think and I said, okay, fine, let's have a horse race. Let's see the results. We're getting great results on our scholarship kids. We still haven't seen any results on the universal yet, and I suspect we're gonna look awfully good on that metric as well.
Wei and Mary, what could you add to this? What have you learned about these different proposals, the effectiveness of them, and the conditions that make these different approaches effective?
Go ahead. Sure. So again, I think I agree with parent choice, right? The parents need to find whatever works best for their children. And sometimes it's public schools because of all of the other programming that public schools offer. In the preschool program, we also offer, if you are eligible for preschool, you're eligible for English Learner Services. You will have access to special education services. You have access to free lunch, free breakfast. You have access to free transportation. That might be a choice and a need that a parent has. Others might need to go earlier on and do, early childhood special education or early childhood family education, which have those really strong family components to it and really addressing the needs that the parents have. So I think, again, and I just want to say, I think we often talk about the limited resources. I think it's about prioritizing how we spend the funding. You talk all the time about the $1 billion that we've put into football stadiums. We could have reprioritized that and put that into education, into early education. So again, it is how are we prioritizing the dollars that we have? For too many years, I've seen a lot of fighting amongst people who all want to do the same thing, who all want to address the needs of our littlest learners, and we've spent so much time fighting each other rather than saying, let's prioritize what we have and let's fund everything that families and children need. And every family, every child is different, and they all need something different.
Yeah, so I
Very well put.
I like your point of view on that. I don't think this always has to be an either or. I think it can be an and. I'm concerned about solutions that don't get down to birth to age 3, because so much happens by age 3 that if we miss that opportunity, kids start at a disadvantage. And so I want to see solutions that connect with parents, that start earlier, that make sure that people get the services they need for their families from those earliest days and months of life. And if that comes with universal pre-K, I believe that parents need choice. And when I say universal, I mean available to all, not only in a public school. So I hope that that option is available for all families as well, but I really want to see those little ones get a great start in life.
I just want to say, in a way, you should think of the scholarship model as both, because our parents can choose public when it works or private. So absolutely agree. And I absolutely agree, if we make this a priority, and that's where we have to market, we have to be able to not just show the research, but we've got to actually market, which we are trying to do in the state. We've got an organization called Mini Minds that goes out and lobbies. We have to do that. We have to get as much press as we can possibly get to make this a priority. If it's the Viking Stadium became a priority. They never asked how you're going to find the funding. They just did it. We have to be the same way. We have to make it clear, and they'll find the funding, but it's got to be a priority. And I think that's our job in terms, I view that at being at the Humphrey School of Public Affairs. Our job there is to take the research out to the public community, out to the legislators, out to in that public space, and make it a priority. And how to do that, and we're working on it.
I think we have a few minutes left for questions. Is that right, Rob? We have 10 minutes. I think someone will probably go around with mics.
Yes.
Thank you very much. Thank you very much for your time. I guess my question is that we have to make it a priority, yet you said that in America we don't do any of the 4 things that we need to do. None of them, 0, you said. So what do we have to do? How do we get to the root of that problem? Why in America do we not do any one of those 4?
Boy, I think if there was an easy magic answer, we would be doing them. So, in fact, I've been in a number of conversations lately where people have talked about just that. So I do think some of it has to do with information and education and shining light on the importance of those earliest years of life, because people don't know. So in California, they put all their tobacco settlement money into the first 5 years of life, and what they learned is parents don't know. So I think that is a prerequisite for taking action in this area. And then some of us have speculated, so I'd be interested in others' thoughts on this, that we've gone so far in changing the way we think about children. So if any of you have read the book, Our Kids, it really talks about raising kids used to be a community activity. And now we isolate families and, your kids aren't my kids and your kids are your business, but they're not my business. And we don't have that collective attitude of our kids are all our children. And would we have a different set of actions and behaviors and beliefs if we believed that? I think we maybe would. That's why I still believe many times, many ways, many messages, we need to create an environment where all of us in the community, whether we're grandparents or parents, start to stand up for kids. And we haven't gotten there yet. Arts program would be funded if we believed that, if enough of us believed it.
Let me just add a comment to that. You think about it politically, and I was in Chicago, Illinois, making these comments, and Rahm Emanuel wasn't happy with my comment, but I was saying, think about it politically. These kids don't vote. These little kids don't vote. What kind of, their families hardly, are involved in the political system. They're under enough stress. So, no, I said, that's true in Minnesota. I don't know, in Illinois, maybe they do vote. So. But they try. But that's the political issue, right? Again, I hate to pick on the Vikings. This is not just the Vikings, but they had all these people that voted, right? And they got out there, and they're intimidating actually, but they vote. That's why we need to go beyond. We got to figure out a better way to get into that political space and make it a priority. So it takes some leadership out there, and it takes the healthcare community, and it takes the education community to say it's unacceptable that these kids are not succeeding. We know how to make this happen.
One of the things that we haven't talked about is the workforce. And without women in the workforce making enough money, we are going to continue to have the childcare shortage that we have, and we're not going to be able to make any of this work. So I would like one of you or all of you to say something about the early childhood workforce.
I agree. And I think we put so much emphasis on early learning and the brain development and what the individuals working with the kids need to know. And we don't put enough resources into actually training and educating and mentoring those individuals that are working with our children. And until we really recognize that as a profession and as a profession that really needs our support, I don't know how that's really going to change. So I do know that, with you and with the Early Learning Council and others, we've been working around workforce, and I think what we need to do is we need to partner with, there's workforce shortages everywhere in the state, right? And again, so let's not compete against the fact that you have workforce shortages and I do too. We all have workforce shortages. So what can we do? And I think, I don't know if higher ed is at the table, but I think higher ed is an important player because I think that they need to be more, they need to work faster to produce the programming that we need to educate these individuals. They need to understand what the individuals need to learn, because I think what I've been hearing is perhaps we are turning out individuals who maybe don't actually have the skills and the knowledge that they need to work with our smallest learners. So I think that we have to work with our higher education institutions to really have them understand what the needs are out there.
So Nancy, economists will always talk about incentives and give us the right incentives and we can make the system work. And you heard me say earlier it's about funding. So if we get the kind of funding we want for these scholarships, and the scholarships, the early learning scholarships we did privately paid up to $13,000 a year. We demanded quality from these programs. So if we get that scholarship generous enough, center-based programs, family, friends, and neighbor programs that are 4-star, if these scholarships pay well enough, they can go out and entice future educators to get in the field. But they have to know there's going to be a profession there that's paying well, at least as well as the public schools are paying, an elementary school teacher. That's where we got to go. There's different ways of getting there, I admit. I like the demand side. I like to empower the parents, give them the resources, demand the quality, so these providers have to go out and hire high-quality people. And now if it's sustainable, if the funding is sustainable, then I'm willing, if I'm I want to be a teacher, I'm looking at elementary, maybe pre-K. If pre-K is at least going to pay the same, then we have a chance at solving your problem. I absolutely agree with you. It is a problem. How you would solve it, I'll go back to funding. This is one way to fund it, and we have some evidence that our scholarships are, and the quality rating system is raising salaries a bit. We got a long way to go. And the shortage is there. The shortage, as you know, is economy-wide anyway. But for long-term sustainable results, you've got to make sure you're paying at least as well as you're paying elementary school teachers.
Here's the question over here.
So I have another kind of resources question.
No.
There, try it now.
Now you got it.
Another kind of resources question. I think the federal government is running a competitive grants program for early learning. So I'll just speak up. So my three-tiered question. Is Minnesota going to apply for a competitive grant? If so, is it going to build the application around something like what Art Rolnick was describing as the Minnesota model? If not, why not?
I can take that. Yes, Minnesota is applying for the preschool development grant. What we are applying for right now is a planning grant, which is just a one-year planning grant. So the intent of the grant is not to actually implement new programs. And so, no, the Minnesota model would not be part of what is in the current application because it wouldn't fall under the planning. After a year, there will be the ability for states to apply for an implementation grant, and that would cover, now someone can help me, is it 3 years of funding? And we have I know there have been discussions about what could be in the implementation grant, but at this time, I couldn't tell you exactly what would be in there.
Just a footnote here. The fellow that asked that question was Rob Johnson from Cargill. And if it wasn't for him and his boss getting the business community to create the Minnesota Early Learning Foundation, we would not have had the success with this program that we're having today. I would be just another pretty face.
Other questions?
I just want to, because I'm doing the evaluation in Tennessee of the preschool development grant that Tennessee got some years ago, it's all through the public schools. So you're going to have to do something in Washington to broaden their vision for where this money can go, because currently it is all funneled through the public schools.
So the preschool development grant, a priority of it is also mixed delivery. And so we do have to look, so in our application and in our planning, what we would really look at is how do we have mixed delivery models throughout the state. A lot of what we are planning on doing, again, is doing stakeholder engagement throughout the entire state and understanding what communities need, because one community's mixed delivery model might be different than a different community's mixed delivery model. So that is one of the main focuses that if we were to get the planning grant, that we would focus on.
Good afternoon. Helene Stebbins with the Alliance for Early Success. We are a grant-making organization that invests in moving state policy for young children birth to age 8. Recently came into Minnesota, in part because you're a leader in some ways about what you've done and the state investments that you've put behind it. But what we're really struggling right now with is how do we move high-quality access to comprehensive programs in rural settings. And Minnesota is a rural state with great rural infrastructure, so I'm wondering if you could each just talk about what are the unique challenges for addressing rural populations, and even better if you have solutions on how to do that.
Big challenge. I can predict that Art will say having the scholarships in place will create demand that then business will step forward and fill. And I really hope that's true. And also, we've got huge holes in childcare that exist right now in rural communities. I think the workforce challenges are exacerbated in rural communities, made even more challenging by distance. So I wish I knew of some additional solutions that would address that problem. I see it as very pressing, and when we talk with people around the state about the need, they'll say, hey, all those ideas you guys have in the metro area, those are wonderful, but I can't access any childcare at all. So I think you make a very important point, and glad you're here to help.
Yeah, you should be talking to First Children's Finance. Jerry Cutts and Heidi are here, and they're working on that issue. I want to make it clear, we work with family, friends, and neighbors, and even though I'm a big scholarship guy, we do put in some funding to encourage and help family, friends, and neighbors become 3- and 4-star rated programs. That's infrastructure that's out there that we've got to incentivize to improve. We need the public schools out there as well to expand their programs. So there are ways of doing this. We won't solve it all, I know, but we can go a long ways, yes, with scholarships to provide the incentive, but to work with family, friends, and neighbors and work on that infrastructure. I think that's the only way we're going to get there.